Good morning and good afternoon, and a very warm welcome to our first Perspective series of 2021 and our third in this event series. It's great to be back with you today discussing a topic that I know is extremely relevant to all of us given the industry we work in, but also as individuals living in this new world. When we started these events in the midst of the first wave of the virus, we probably all thought that this way of working was only temporary. However, here we are a year later, still very much living with the virus and spending most of our lives talking through computer screens. For us at Bupa Global, Perspectives has been a really positive development, enabling us to connect with you, our intermediary partners, in a way that we never thought or dreamt would be possible. And whilst we all hope we will be able to see each other again soon, these digital events will continue regardless, because nothing replicates the truly global extent of these sessions. Last year, we reached over 1,000 people across 14 different countries with consistently high levels of engagement, which hopefully suggests we're getting the content right. But as always, we're keen to get your feedback so we can continue to deliver events that you find useful. So please complete the short survey that we'll send after today's event, or send us an email about issues you'd be keen to hear about. But before I introduce today's topic, I wanted to thank you again for your continued support. And wherever you are in the world, and whatever time zone you're in, it's great to have you back with us again today. So, over the last 12 months, individuals, businesses and societies have been scrambling to adapt to extraordinary circumstances. While the fight against the COVID-19 pandemic is not yet won, there is at least now some hope that things may return to some form of normal in the near future. As I'm sure you're all aware, there are now several vaccination programs being rolled out across the world, which is a real triumph for the scientific community, but also a future model for how private companies, governments and the academic world can work together for a greater good. Lots more to come on vaccinations later in the session. Barring any other unexpected catastrophes, 2021 is set to be the year of transition, when we begin to look forward to shaping our futures rather than grinding through the present. In 2020, you may have read numerous news pieces and countless business presentations claiming a COVID revolution in almost every industry imaginable. But in reality, no industry can match what we have seen. Almost every sector has had to adapt and accelerate their digital offering in response to changing customer behaviours. Our sector is no different, but we have also benefited from an exponential rise in people's interest in their own and their families' health and well-being. These three factors combined, advancements in digital technology, changing customer demands and behaviours, and a unique focus on health and well-being, means that we're living through a supercharging of healthcare innovation. The question for us all today is, what does that mean for us? And more importantly, what does it mean for our customers? You'll hear some of the answers to this question later on, but from my perspective, this is a very exciting time for our industry. There is undoubtedly a long way to go, but through the advancements in digital technology, we now have the opportunity to make healthcare more personalised to individual needs and moving away from a one-size-fits-all approach. We are hoping to reach a place where no matter what your race, your gender, your cultural background, sexual orientation, or disability, you can easily access healthcare that is as unique as each one of us. Equity and access to health services is vital in order to create a world where health inequality doesn't exist, and that people get treatment which is both effective and appropriate to their health needs. The purpose of Perspectives is to give you an insight into how to take advantage of this new world, because ready or not, we must embrace it or be prepared to be left behind. We want to bring you the future first by taking a closer look at the biggest healthcare trends and innovations set to define 2021 and beyond. But more about that shortly. But we want to provide you with relevant and useful insights to prepare you for the sort of conversations your customers will be expecting, so you stay one step ahead. So to help you do that and to explore the topic in more detail, I have the great pleasure of being joined by a panel of some of Bupa's leading clinical experts. Firstly, Claire Scully. Good morning, Claire, Director of Clinical Development. and Dr. Luke James, our Medical Director. And in a short while, we'll also be joined by Dr. Bertalan Mesko, Director of the Medical Futurist and one of the world's leading voices on the future of healthcare. Just before we get started, I'm sure you'll all agree we've got a really strong lineup with us all today, and I'm extremely interested in what our experts have to say. I'm sure we will all learn something new. But to ensure we get the most out of it, we're also really keen to hear from you. And for those of you that have joined these events before, hopefully you know the drill. It is important that you know that the line is on mute and will stay on mute throughout the course of the event. But if you do want to ask a question, please do so using the chat functionality on the right-hand side of the screen. You can ask a question at any point during the event. The events team will take your question and ensure it gets directed to the right person at the right time. So please do feel free to ask any of our panelists any question you're interested in. So welcome, Claire and Luke, and thank you for joining us this morning. Of course, the focus of today's session is the future, but we can't have a meaningful conversation about what happens next without talking about what's happening now, and particularly how countries around the world continue to deal with the implications of this dreadful virus. Luke, I'm going to come to you. Given the global audience that we have with us, can you just provide a snapshot of the latest COVID numbers?
Yes, thanks, Paddy. Good morning, everyone. So COVID, we know, continues to affect us all varying ways across the world, and we've seen the virus ease in some parts, such as China, Singapore, Australia, but we've also seen it accelerate in Europe, parts of South America, and the US with the new variants. So, quite shocking numbers, really. If you look at the latest data, infection rates of around 100 million cases worldwide, death rates of 2.16 million as of yesterday. And I think, just in summary, there's actually a bigger story behind these figures which will materialise over the coming months and years. And that's the sheer level of morbidity and illness, ill health, as a consequence of the recovery from COVID, and equally the devastating impact on healthcare systems with delayed diagnosis and delayed treatment. So I realise that's a bit bleak, but I'm pleased to say, looking ahead, we now have multiple global vaccination programs. So hopefully we're going to see things improve during 2021.
Thanks, Luke. Actually, it's a very kind of brutal reminder just how this virus has affected so many people across the world. Nevertheless, it's hugely positive to hear news of the vaccine. The vaccine for so many people is effectively their way out of the current restrictions and some of the ways of living that have become all too normal. Staying with that, Luke, the world now has a number of vaccination programs. Can you tell us a little bit more about them? Some early insights, what's left to be understood, and what should we be aware of?
Sure, yeah, thanks, Paddy. So I think first thing to call out, the clinical evidence is evolving rapidly in this area. So what I'll share today is correct as of today. Things change while we're speaking on these webinars at times. So currently about 292 vaccines in development across the world. And you'll know many of the names that have been already approved. Those are the Pfizer vaccine, AstraZeneca, Moderna, and China and Russia have got their own vaccines as well. So you briefly touched earlier on this, Paddy, but the development of the COVID-19 vaccines is nothing short of extraordinary. Normally takes years and years to develop a vaccine due to technology, funding, slow processes. And I think because there's been so much money thrown at this and a lot of funding problems and other blockers removed, it's meant that we've really accelerated the development. So huge step forward, but ultimately the success of the vaccine is kind of in the distribution and how we get it out. So all countries have got their own strategy for distributing the vaccine, some kind of priority. Some are focusing on frontline workers, young people. Others are focusing on the high-risk adults at stage 1. So I suppose your experience of the rollout of the vaccine will depend on where you are in the world. And understandably at the moment, and we're fully supportive of this, is that there's no vaccines being made commercially available to private healthcare. Most countries are adopting a public health approach to this, in which certainly in the UK, the NHS is delivering the vaccines to distribution centres and to the people that need it first to have the most effect on hospitalizations and deaths. So many countries around the world, the healthcare sector is more fragmented, and that may be more difficult to achieve. Up to now, we've seen the distributions that countries have made vary considerably. The top five at the moment: Israel, UAE, Bahrain, UK, and USA, and that will evolve over time. I think what I would say slightly concerning is some of the wranglings we're starting to see around vaccine supply. And the Gates Foundation mentioned this back in probably 4 months ago, that it was a real risk for the effectiveness of the vaccine programs and the global economy to get back to normal if there was this kind of vaccine nationalism. So a bit of a concern that's emerging. In terms of unknowns, I think it's important that we're all aware of this. The data on the vaccines is continuously emerging. We will only know the effect once we see the effect in the real world, actually out there in society. So we don't know whether the vaccine will prevent you getting COVID-19 or it will just reduce the symptoms and the severity of the symptoms. It's looking as if it's the latter of that. So even if you've had the vaccine, you can still get COVID-19, but it's just much less severe, which is a good thing. However, it may mean that you can still transmit COVID-19 even though you've had a vaccination. And again, only time will tell whether that risk is reduced or not. We also don't know how long you're protected against. So, how long will that protection last for, and whether you'll need annual vaccinations. And then, of course, the big unknown is around the new variants and whether the vaccinations will work against those new variants coming forward. So it's likely whatever happens, we're going to need to maintain social distancing, masks, hand hygiene, and good infection control practices for a long time. And in my view, they're so embedded in society now that I wonder how we ever will return to the rugby scrum of getting on a tube or a train at rush hour, or greeting a friend with a hug and a cheek kiss. How do we ever get back to that? Behavioural scientists say it's about 12 to 16 weeks to embed new habits. Well, these habits now have been in play for, it's going to be in excess of 18 months by the time we emerge from this. So, quite interesting that we're going to need to maintain those. And then just finally, very quickly, I'm conscious of time, the new variants. So all viruses naturally mutate, and that happens. We know that. What we've seen with the UK, the B117 variant, is that's much more transmissible. We know that. The jury's still out on whether it causes more severe disease and death. Lots of, again, arguments about the data at the moment, and it's early. The South African, Brazilian variants are a concern, and that's why we've seen, tightening of border controls, especially in the UK and elsewhere, because of the fact that mutations have affected an area on the coronavirus called the spike receptor domain. So the receptor binding domain. And that is the worry, because that's where the vaccines are targeting. And so there's some concern that there may be some resistance to how the vaccines are working at present. So it may be in the future that the vaccines will need tweaking from time to time to reflect some of these variations. But overall, I finished by saying, it's amazing news that we're rolling millions of these vaccinations out around the world.
Thanks, Dr. Luke. So I think it's fair to say we're not out of the woods yet, but there is definitely reason to be cautiously optimistic. I think it's great now that we've got a number of vaccine programs rolling out across the world. As you say, a number of countries are taking different approaches, and we've got to avoid this kind of nationalism that potentially is creeping in, particularly in parts of Europe. But, it definitely does feel like a different place to where we were a year ago. One of the things I wanted to kind of pick up, and Claire, I'm going to now kind of turn to you. Obviously, the world has had to adapt to COVID in a relatively short space of time, but nevertheless, we've all had to quickly adapt to new ways of working, new ways of living. How do you think the current pandemic will change how people access care in the future? Claire, have you just got your sound on?
Apologies for that, everybody, and
It's
hi,
okay.
hi, Paddy. I think it's I think it's fair to say that this current global crisis has meant that health has risen up the world's agenda and individuals' priority lists considerably over the past year. As we all know too well, COVID is changing how people behave across all aspects of their lives to a greater or lesser degree. Suddenly, healthcare developments are being widely reported in the media and having an impact on our lives in ways most of us haven't ever experienced before the pandemic. So, for example, some of the things that Luke was mentioning around vaccinations, latest developments in regards to COVID treatments, social distancing measures, and even what activities transmit the virus have never been more important to day living. And this has led more people than ever to think about their health. You know, the pandemic has really brought the importance of being well into sharp focus for many people. They're more conscious generally about health issues and want to know what they should personally be doing to optimize their health and their own well-being. Excuse me one moment. Sorry, Alice, out the way, please.
So
Excuse
don't
me.
worry, Paul.
Sorry.
It just shows you how the challenges of working from home. You can see that this is no longer scripted.
Completely
But
live.
don't worry,
We'll be having words later. We're also
don't
being
worry.
exposed in the news to broader medical advances all the time. So things that would have been reported in academic journals before are now front page news. So a good example of this is with artificial intelligence. It developed by an offshoot of Google that can determine the protein's 3D shape for its amino acid sequence. That torrent of information has been made even more tricky to wade through, given the widely reported levels of misinformation across social media. Not to mention that media reports are often the main way that the scientific community at the moment are keeping up to date with things, with a lag before peer review papers are published. You know, it's not often easy to understand what that paper or finding can mean for an individual, if anything at all. How can they assess pertinence to them and the timescale around that? So, given individuals are more interested than ever in their own health status, maybe using some wearables as well to give them some insight and being bombarded with information, they're trying to decipher what that means for me and people like me. They're looking for a more personalised answer to that question, given their own set of circumstances, including things like their age, gender, current situation, and their expectations of healthcare systems to answer that question in a more personalised way is increasing.
Great. Thanks, Claire. Listen, it's great to get those insights. It's also great to see your daughter so early in the morning. I know she's probably should be homeschooling, so good morning to her too. But I think one of the things that you mentioned is really important. That COVID really has accelerated this notion that no longer one size fits all. That people and systems now will want to drive a much more personalised and individual approach, taking account different demographics and different kind of biometrics. So worth kind of coming back to that. One of the things you talked about was the role of digital and digital transformation. How do you see that being more of an enabler to health?
Yeah, I mean, I think it's fair to say that we've experienced a decade days for digital adoption, both in terms of doctors and patients' appetite to use these systems. And we should expect some of those timelines that or Luke discussed earlier in regards to vaccine development. And in time, we could see that being replicated in other areas. These advances aren't just supporting our ability to deal with the COVID crisis, but the understanding of other diseases and conditions as well. Alongside this, we are also seeing huge strides forwards being made in regards to precision medicines and techniques that are specifically targeted to an individual group. So, if you've ever heard of some of the newest cell, gene, and tissue therapies, so things like CAR-T, they would fit into that group. So, both in terms of how healthcare is being delivered, be that in person, digitally, or a mix of the two, and to the precise nature of what that treatment being offered is leading towards a more personalised model of healthcare. It's about having the flexibility in the healthcare system to offer a more tailored intervention or trusted information at the right time. Enabling interaction with healthcare systems increasingly at a time and place more suitable for the individual. And really at the centre of being able to do that is data and information. How can you deliver the right message at the right time and in the right way to make healthcare accessible? Um, digital solutions are undoubtedly a part of that. For example, using wearables to track markers of health and giving timely feedback, rather than healthcare being point-in-time interactions when you're feeling unwell. Particularly important as we see healthcare systems there to prevent ill health moving forwards. When you think about some of the developments in the predictive space with tech such as genomics and proteomics coming through. One point I would make, though, is that digital is only part of the system. It can support clinicians to be more efficient in the way that they will work, but it will never replace in-person care in its entirety. However, now that we've become used to the idea of getting our healthcare digitally, how can that be taken even further to personalise healthcare for the individual, delivering healthcare in a bespoke way, given the values and perspectives of an individual, and understanding the implications of that from a quality perspective as well?
Thanks, Claire. Really, really interesting insights. Again, some reflections for a number of us working in kind of corporates or big organizations or just in society at large. We are talking about being a more inclusive society, making sure that, everything we do, it recognizes the kind of the distinct kind of individual uniqueness of each one of us. And it's interesting that healthcare is going along a similar route, making sure that, the healthcare that we get access to and we get is not just inclusive, but personalized according to your particular needs and stuff. So that's really interesting. And also recognizing that digital isn't the answer to everything. It's great that digital has been able to make healthcare more accessible, but actually there'll be a number of things that digital will have certain limitations to, and that face-to-face interaction. So, thinking about how these trends evolve over time will be something I'm sure this audience will want to explore. Now, slightly different than last time, one of the things we took the opportunity to do was to ask a number of our intermediary partners for questions in advance. This is something that we'll continue to do in future events. So if you're interested, then please do speak to your Bupa Global account manager. Now, the first question comes from Steve, who works for Willis Towers Watson in Dubai. And his question, I believe, is to you, Luke. So, Steve.
Hi Paddy, thank you to you and the panel for today's session. My question is in relation to Bupa's perspective on the role of genetic screening. How do you see the role of genetic screening in risk management and disease prevention in the future? And are there any specific initiatives that Bupa is looking at around this particular area? Thank you.
Thank you. So the great question from Stephen. I think I could spend the whole webinar on this, but I'll try and briefly answer in kind of three areas. So, firstly, absolutely fascinating area. It's not just in the genetics arena, but the next stage on from that, proteomics. At Bupa, we're already funding genetic testing in cancer where it's evidence-based. We've got a clear strategy on approval of these tests, and they're incredibly useful to target therapies in a very personalised way in the cancer arena. And I think clearly from a screening and risk prediction perspective, being able to improve risk prediction and risk stratification for our members and future members with these kind of technologies is incredibly useful. But I would caution that it brings with it ethical, moral, as well as significant commercial issues. And then just finally to say, these technologies are amazing, but they have the potential to completely undermine the fundamental basis of the risk pool in insurance. And as we see this testing being marketed direct to consumer, the potential for information asymmetry between consumer and insurer is huge. However, I personally see that as an opportunity to shake up what health insurance is, and we move more into a preventive well-being space rather than paying out when you finally get unwell. So as I say, Bupa specific initiatives, clear strategy around genetic testing for cancer, and we're actively looking into the more predictive type testing associated with lifestyle and well-being with our provision businesses.
Great. Thanks, Luke. And actually, it's actually an important point to note that I think one of the things that makes our sector within health insurance more relevant than ever before is the fact that we do tend to cover preventative and well-being or wellness type treatments and services, unlike many of the domestic insurances. So I think this is really an opportunity for our industry and our particular sector within the industry to really underline our relevance. So our next question is from Louisa, from our partner in Greece, Comergon. Louisa, what's your question? And I believe this is to Claire.
Hi, I am Luisa from Comergon, Greece. My question is, digital health is seen as a real savior throughout the pandemic, but how inclusive is it?
That's a great question. Thanks, Louisa. And I think it's absolutely true to say we've all definitely turned to digital to help us face the spread of coronavirus, be that searching for advice online, virtual appointments, and even to book tests. I guess the challenge now for digital health solutions, how can they support an individual? Every person is unique, and in many ways, so are the conditions, diseases, and healthcare challenges we face. So, take, for instance, women's health and the genetic risk of certain cancers. So, personalisation is key here. We should also remember that digital is a solution in itself as well. And by that, I mean offering more ways to interact clearly, such as simultaneous translation. Another good example that I'd flag of digital right now is to support mental health. So in this space, digital interventions provide more flexibility, choice and control. And this enables accessibility for those who struggle geographically or practically to access services before. Saying all of that, digital health is not a panacea to inclusivity in health, but it is an important tool to making that happen. And neither is the digital the answer for everyone. For example, people with a lack of digital skills, accessibility and connectivity problems undermine digital inclusion, and therefore it's important to give good consideration when developing solutions for people over 65, those living in rural areas or with visual or other disability. However, I think it's fair to say that digital and tech solutions do give us a chance to rethink the healthcare system for future generations so that access is more open and personalised.
Thanks, Claire. And our final question is from Stephen from the Insurance Concierge in Singapore. And this question also is to Luke. Stephen.
Hi, this is Stephen here from Singapore. I have a question. Is the COVID-19 vaccine safe for cancer patients?
Yeah, so another great question. So the bottom line is yes, it is. I would say always discuss with your healthcare professional, your consultant, if you're in that position of unfortunately, suffering from cancer or previously suffered from cancer. The Joint Committee on Vaccination and Immunisations, the JCVI, which is an independent committee that advises the UK Health Department, has made it clear that they believe the vaccines are safe for use in people with a weakened immune system. And certainly the Pfizer, BioNTech, AstraZeneca vaccines, while they haven't been tested in people receiving anti-cancer therapy, specialists agree that vaccines are safe in this cohort of patients and are really important to have, because clearly we know from the data you're more at risk from severe COVID if your immune system is weakened.
Great. Thanks, Luke. Great news for cancer, people living with cancer. And a massive thank you to Steve, Louisa, and Stephen for your questions in advance. As I said, this is something that we are keen to do for future events. So if you are interested in asking a question, then please do speak to your Bupa Global account director. Okay, moving on. I'm delighted now to introduce Dr. Bertalan Mesko to understand more about short-term healthcare trends, but also what we should be looking to for the future. If you have any questions for Bertalan, then again, please send them in. Use the chat functionality at the top right of your screen, and we'll pick them up in the Q&A session. But without further ado, Bertalan, over to you, and good morning.
Thank you, Paddy, and good morning to you all. Thank you so much for having me here. In this very short talk, I will try to give you an update about where healthcare is heading, how COVID is impacting all that, and more importantly, how we individually can prepare for whatever is happening next. I will focus on the major healthcare trends for 2021, as well as describing the context about why these changes take place these years, especially during the pandemic. I'm afraid that all of us have to become a little bit of futurists ourselves now. There are so many changes, not only because of the pandemic, but maybe partially because of that we have to learn to live a little bit in the near future. And you will never find out what has helped me doing that, even in my professional job. Science fiction. Science fiction makes you ask questions that you would never ask in your daily routine, in your job, in your discussions with your family members or friends. These questions such as what if our privacy is dead because of using advanced technologies, or what if an algorithm can provide empathy for patients even better than a human medical professional? Or what if the final destination of humanity is not on Earth and we have to keep on discovering and beyond? You don't ask these questions normally, but these questions or such questions do help you prepare for whatever is coming next. Let's just play on with this little thought here. Like, what if we just stare out of your window? I'm doing the same thing right here, and I can tell you what I'm seeing out there. Maybe the biggest milestone in the history of humanity, the alien civilization, the first one that made contact with us. Let me describe how you would feel yourself seeing what I'm seeing right now. You would feel like these are huge spaceships. Those aliens have shiny armor and deadly weaponry, and they brought beasts with them we never seen before. And of course, they speak an unspoken language. I'm sure I would feel like this is the biggest thing I've ever seen. And in the next moment, I would get terrified to death about what might happen next. This is the same feeling that the people of Montezuma felt when they saw the fleet of Cortez for the first time in South America hundreds of years ago. They thought that those are spaceships, so those people must be gods or aliens. They had shiny armor and deadly weaponry, and they brought beasts with them they'd never seen before, and they spoke an unspoken language. The people of Montezuma, the Aztecs, felt that this is the greatest thing ever, and then I'm sure they were terrified to death. You see, that's why it's so crucial to not just technologically, but also culturally and emotionally prepare for whatever is coming next. And it has happened to me too. I was a 6-year-old kid when I got a book from my mother about the scientific method, and I fell in love with the whole idea. So I wanted to become a researcher. And that in those years, in the late 1980s, I was inspired by some pretty good books and science fiction movies. So I was certain that by the time I would go to medical school, I would use advanced technologies, artificial intelligence, virtual reality. But it didn't happen. I just studied anatomy like anybody else from two-dimensional images and textbooks. But recently I came across a head-mounted mixed reality device, which I could just put on, click on one button, and then it happened. I had a holographic image of a human three-dimensional body appearing in front of me, and I could dissect that human being without physical limitations, not even the formaldehyde smell. I felt like being that 6-year-old kid again, and there I met science fiction. This is the feeling that you all have to prepare for, meeting science fiction, coming across a technology in practice that you will think that this thing can make life better. It can provide hope about the future becoming even better. But to see this in action in the most important industry of all, healthcare, we have plenty of things to do, because I think you have the same experience, and I can see your eyes right now, but I think you have the same experience as I do, that while in many areas I see amazing technologies, I just don't come across many of those in this space, the point of care, the most important space in a human being's life. So at the Medical Futurist Institute, we are trying to find out why we don't see science fiction-like technologies in everyday healthcare. And we think there are at least 3 major reasons for that. The first is about healthcare not being designed primarily to be open to innovations. There are many sub-reasons for that, such as the doctor shortage we see worldwide. 5 million healthcare workers are missing, which means you and we will always live in a world with doctor shortages. We will never train as many physicians and medical professionals as we need. So we need to get used to it and maybe use technologies to fill that gap. There is a trust issue. When there is no time for patients, there is no time to build trust. There is a financial issue. If you live in a country with a socialized medicine system like I do in Hungary, I do get access to care, but there is simply not enough financials for innovations. If you live in a country with a private insurance system, you can get all the innovations you want, but there is a gap. The 1% wealthiest Americans today live 10 years longer than the bottom 1% Americans. And this is just about the access to care. Imagine what happens when it becomes an issue about I can afford printing out a liver tissue and you cannot. You have to wait for an organ transplantation. I can get an exoskeleton after an accident to get back to work and life, and you cannot afford that. This gap is an ethical gap that we cannot allow happening, but it seems that we are heading into that direction because of how healthcare has been designed the last couple of decades. That's the first reason why we don't see these advanced technologies in care. The second is more about us, that it takes time to accept and adopt new technologies. We eventually do, but it takes a lot of time. 200 years ago, that's how we listened to the cardiac and lung sounds. That was the stethoscope. The ear was a stethoscope of the physician. And then the French physician Laennec came up with this brilliant gadget idea, a hollow wooden tube that would augment the sound that they hear. But it took him 30 years, 3 decades, to get this message across because physicians worldwide didn't want to use a gadget while practicing the art of medicine. But we accepted it. If this thing is around your neck today, you must be a medical professional. The issue is, before we had 30 years for one technological innovation, and now there are 30 technological innovations coming out every day or so in medicine and healthcare, and nobody is prepared. So of course, we are slow in adopting these changes. But then comes maybe the worst reason why we don't see science fiction in healthcare, the third one, that it's easy to be afraid of the unknown. And I'm not talking about fitness smartwatches or genomic screening. I'm talking about the elephant in the room, artificial intelligence. When in the 1990s, the best computer, not even AI yet, could beat the world's best chess player, Garry Kasparov, plenty of people said that that's the end of chess. No one would play chess ever again, because why would they do that when the best player is an algorithm? The truth is that today 600 million people play chess every day. I do. I hope you play chess too. It's incredibly useful. Chess is on the top. Really, everyone is playing chess. Everyone is talking about chess. But every chess player works with artificial intelligence. Every chess coach works with AI. Even us, people who just watch tournaments, we need AI's help to evaluate the positions live while players are playing. And we cannot think of what grandmasters have in mind, but the AI evaluation helps us find out what might be going on the board. So chess has become better, but everything in chess is about artificial intelligence. The best chess player today is an AI-based algorithm called AlphaZero Lila. And even then, about 2 years ago, the best Go player was beaten by an AI. And Go is a different animal. The Chinese board game called Go is really complicated, much more complicated than chess. Just to give you a picture here, there are more potential positions on the board than the number of atoms in the universe. So it's physically impossible to build such a big computer that could calculate every single move. In Go, therefore, what you need is a bunch of human skills, creativity, intuition, things that we think only us people have. But then the best algorithm called AlphaGo could beat one of the world's best players, Lee Sedol, on the right on the image. And I think that time it became clear that something big is happening. Artificial intelligence is becoming available, and there are many cognitive tasks where we cannot and shouldn't compete with AI. And that's why it's easy to be afraid of the unknown. It's especially easy to be afraid of AI and what if it might replace my job? What if it introduces new changes to my life? And all these things are in the picture. But because of these 3 major reasons, we think that even though you see amazing technologies, what's going on in healthcare in the 21st century is primarily not a technological revolution, but a cultural transformation. Because it's much more important how the doctor-patient hierarchy is transforming into an equal-level partnership, how the role of the passive patient is shifting into a proactive, empowered patient who wants to get engaged with their care, how a physician's role from being the key holder to the ivory tower of medicine is transforming into a guide for the patients in the jungle of health and digital information. These things matter so much more than which smartwatch or microchip comes out next year. This is why digital health is a cultural transformation. It uses disruptive technologies, but it leads to an equal-level partnership and on the long term, the democratization of care, meaning that healthcare is going to be global. I won't depend so much on my country's healthcare system. I will depend much more on a globalized network of professionals, peers, services, technologies, and so on. This will give me a better chance for a long and healthy life. So summing this up, what has been going on in healthcare, it's this. We have to shift the point of care into something new, something modern, something from the 21st century. Digital health is about making patients the point of care. That's the end of the line. Any technology, any trend, any service that points into this direction must be on the right track. I think one of the prominent examples is remote care or telemedicine. Telemedicine used to be a shiny thing, a shiny technology some people might want to use. Now, this is the new norm. Since last March, this happened in weeks last March and April, people had to start using telemedicine, either as patients or professionals. Otherwise, they wouldn't have been able to access to care or provide care for others. Telemedicine not just will stay with us until the COVID-19 is over, telemedicine is going to be the new norm. It's going to be a luxury to see someone in person. I'm not saying that it's bad. Seeing someone in person is the only way to build a relationship based on trust. But after that, in monitoring, in the long-term treating a condition, you can use telemedicine very efficiently to have a good kind of communication with between patients and medical professionals. But I wanted to leave you in the last couple of minutes with a few real-life examples or principles that we might want to keep in mind while preparing for whatever is coming next. And the first thing of the three principles is, for me, the most important thing: patient design. Patient design means that you don't just ask patients how they want you to do your job, what kind of healthcare they want for themselves. It's involving them on the highest level of decision making. I saw this happening in action. I went to see a Dutch hospital where they designed a new facility for the hospital, and they invited their chronic patients before the first plans were ready. And patients had their voices heard. They asked for round tables. So they don't sit in front of the physician, not accessing any information, just seeing the back of the monitors. No, they see the same things at the same time. They can bring data to the table and they look at that at the same time. And when they are finished the discussion as partners, they go to the clinic within the blue line in the same room. It was called the clinic, where a physician could professionally examine a patient. That was a dentistry clinic, by the way. When they are done, they go back to being eco partners. Patients love this space because it gives them power. It makes them engage with their care. Physicians love this space because it's easier for them to work with empowered patients, less stress, less time, less burnout. And I had to ask about the cost. I'm Hungarian, so I had to know how much it cost. They told me that's an IKEA table and that's blue duct tape on the floor. That's the cost of patient design. So every company, every healthcare organization, every health ministry must have a patient advisory board. Patients advising people in the organization on the C-level of that organization. That's the most important principle of respect for the foreseeable future. The second point is about how good technologies can augment what we do, how you do your job, how you take care of yourself, you do your disease and health management. And I think it comes down to how roles are changing. The role of a physician, translating information, data, answers for questions from patients, physical examination into actionable steps, treatment, diagnosis, monitoring, I think it's going to shift a little bit, but the biggest thing that will change so much is the tool set that they are using. Instead of a blood pressure cuff, they will use connected combined devices like the ones I have that can do an ECG, have a digital stethoscope built in, a blood pressure at the same time. They will use genomic data, they will use AI, that for anyone who has been taking part in translating medical information into actionable steps for patients, have to keep this in mind, that this toolset will profoundly change in the coming years. And of course, the biggest toolset change will be about artificial intelligence. So I just stop here for 1 minute and no more, describing where we are in AI. Artificial narrow intelligence is the one thing that we have today. It means that AI is very good at doing one very well-defined single task. It's great at spotting cancer on CT scans, but cannot provide care for patients. It's great at helping a self-driving car find a parking spot, but cannot drive the car perfectly in alone. Then we might have artificial general intelligence, meaning that one AI has your cognitive capacity. And in the science fiction-like future, we might have artificial superintelligence, meaning that one AI has our humanity's cognitive capacity. That's the Terminator scenario. You can find out yourself. So the plan is just not to reach artificial general intelligence. So we can benefit from using AI, but not in a way that we lose control. We don't want to lose control, not in 5 years, not in 50. We people want to be in control. We need empathy. We need compassionate care. I need a human being telling me that in my vulnerable state when having a diagnosis that That's going to be all right. But I want that person to use a range of advanced technologies, such as artificial intelligence. AI is even being used in mental health care. Usually about 5 to 10% of patients experience depression-like symptoms. During COVID-19, it's 50%. I struggle myself. I'm sure you struggle yourself. It's awful for all of us, without exceptions. But in some countries, like in the UK, they started deploying AI-based chatbots to help people get some sort of an empathy-based conversation until they can get to a psychologist or psychiatrist in person. In the waiting time, they have this technological help. They know it's coming from an AI, but at least it's something, and they are not left alone completely before seeing someone in person. That's, I think, a great use of the technology. But summing this second point up, the vision we share at the Medical Futurist is not this, that let's put more interfaces, more monitors, more gadgets into the doctor-patient conversation. My vision is about this, that there is none. There is a physician talking with a patient, building relationship based on trust, providing compassionate care, while also being surrounded by advanced, seamless, invisible technologies. AI-based chatbots, voice-to-text technologies, smartwatches, health sensors, anything that can make prevention a real thing, anything that can make my treatment as precise as possible. Because we are different, not just genetically, but also metabolically. Our digestion is different. Our lifestyle habits are different. The habits we get from our families and from our background are different. So we need tailored therapies. And the third point here is about this, that precision medicine, tailored therapy group of principles, that the future of consumer is here. Millions of patients have been living like I have been living. I have been living like a patient from the near future because I can track my sleep, and I have been tracking my sleep for almost a decade now. I have a smart sleep alarm, so I wake up at the best time from light sleep, not from deep sleep. I can measure my fitness activity. I measure my performance while doing exercises. So I push myself to exercise 30 minutes on average every day, even though I hate going out for a run again and again. But I can do that because I found motivation in data. I try to find ways to reduce stress with gadgets. It didn't help. I try to meditate better with gadgets on my head. It didn't help. But at least I know what I need for a good meditation. I know what I need for trying to reach mindfulness in the long term. I've had genomic tests, so I know exactly what kind of medical conditions I might have a risk for, and I brought that data to my medical professional. I know what kind of medications would cause me side effects, because genetically, I would reply to them, I would have a response for them in a different way. And even I had my microbiome tested, so I know what kind of bacteria live in my digestive system. So I can adjust my diet based on that with a partner physician I have in the place of my primary care physician. Patients from the future will live like this, not in 5 years. Millions of patients have been living like this. And I think it's inevitable for all of us. Even if you don't want to live in a digital world, you want for yourself, I guess, a chance for a long and healthy life. And for that, you need data, you need insights that you already have, but can access them, because it was only accessible in the ivory tower of medicine. But now you can make it happen. And every patient will make it happen when they find out they have a choice. So summing everything here up, I think COVID-19 has impacted digital health in a partially positive way because the adoption rates are amazing. But the real fear I have is that the cultural transformation is lagging behind. The good news about that is that if the technological revolution just took place in weeks last year, to put next to it the cultural transformation, you don't need regulations and new gadgets. You need just yourself. New changes, maybe a few principles in yourself that make sure that you can adjust your life and to this digital health world, and thus you can have a chance for a long and healthy life. This is how advanced technologies can facilitate this transition, and I think this is a vision that's worth fighting for. Thank you so much for your kind attention, and back to you, Paddy. I'm looking forward to the questions.
Bertalan, thank you so much. I am absolutely certain that I speak on behalf of everyone on the call to say that was absolutely fascinating. It's great to kind of get your insight and your thoughts in terms of the future of healthcare. So thank you. We're going to open it up now to questions. So as I've said before, your line is on mute, so you can't actually ask through the webinar, but you can post a question using the chat functionality on your computer. You'll find it, I believe, in the top right-hand side of your screen. We've got a number of questions already, but not surprisingly, Bertrand, first question is for you, and indeed lots of questions regarding data privacy and data security. You talked about those initial explorers and visiting some of those countries and some of those countries being terrified, scared of what they're seeing. And trust is such a big part of every healthcare system. How do you get people to trust that any kind of data that they give technology firms won't be misused or used in a cynical or negative way?
I'm afraid this is the biggest question that anyone can ask about digital health here. And just a moment before I really answer your question, I think, or I'm afraid, there is no digital health revolution without losing some of your privacy. Without your data, your medical records, your health data coming from your trackers and health sensors that you use, it is physically impossible to improve artificial intelligence or any kind of technology that can help you live a longer and healthier life. That's something we have to accept all. But still, gaining trust will not happen from big companies. There is no way that a big company can prove it to me that I can trust them. But I trust my medical professional. And if they have enough knowledge about how these companies work and how they utilize my data, and if they tell me that, then I trust that person, the medical professional that can care for me when I'm in a vulnerable state. I think that's the only way, so through the doctor-patient relationship, that we can gain trust in using these technologies.
Great. Thank you, Bertrand. Claire, I'd like to kind of come to you again. Questions regarding adoption of digital technologies. So, as Bertrand says, there's lots of really good technologies out there, but actually getting people to physically use the product, use the service. How do you do that at a time that it's probably easier for them to access rather than the time that they're ill or sick and probably not motivated to download technologies? How do you drive adoption of those technologies?
It's a really good question and a really pertinent one. How do you drive engagement, not only in the near term to adopt a new behaviour or, be that a preventative a health promotion type of behaviour, or when they're, not so well, how do you maintain that? So there's that part of how do you use, the broad swathe of behavioural science that's come to the fore through the pandemic to support you in adopting those behaviours and the opportunities that digital solutions give you in that space. Not least because they can be part of your everyday life, integrated into the way that you are, living day to day. But how do you continue those over time? And they're challenges that we're all grappling with in these digital solutions, but I think offer real hope and opportunity in the longer term.
Thanks, Claire. Look, a question for you. There is kind of increasing concern that people's almost addiction to social media and to technologies actually is leading to poor mental health outcomes. Do you see from a doctor perspective actually technology having a negative effect on people's health and well-being?
I think sadly the answer is yes to that, and as with all these things, it's about moderation, isn't it? And I think what we've been exposed to over the past year is incredible doom and gloom on a constant 24-hour basis. And if you just look back to the late 80s and early 90s, you would have had to wait for the 6 o'clock news, the 10 o'clock news, and there'd have been a gap in accessing new information during that time, in which, in a sense, you could allow your brain to recover. We're now in a situation where, if you want, you can live stream the latest grim data, grim news, 24 hours a day, and access it from multiple media outlets, as well as layering onto that all of the social media that's out there. So undoubtedly, I think it's going to cause, it does cause mental health issues. But what we would hope is that we can utilize that technology and engagement to really promote, good mental health.
Thanks, Luke. Bertrand, a question for you. Now, this may seem slightly unfair because there's a little bit of a political dimension to it, so maybe slightly outside your sphere. But kind of one of the questions we've just been asked is, Luke talked a lot about potential risk of countries becoming much more nationalistic over their healthcare provision, and yet, some of your future view is that actually healthcare may become more of a global service. How do you get countries much more comfortable that being able to access care and services globally isn't a bad thing?
It's a great question, and I think it doesn't depend on whether countries want this or not. It depends on whether business companies want it or not, and they do. There is a literal chance today that I can send a cancerous tissue from Hungary to a Belgian startup that can sequence its DNA, finding out whether there are any clinical trials based on a database in the US where I would be welcome with my tumor mutation to that clinical trial, maybe run by a French pharma company on a Spanish island. So I could get the world's most precise, most targeted therapy for my cancerous tissue without meeting anyone in my country's healthcare system. I'm not saying it's ideal. I'm saying it's absolutely possible. And my healthcare system, my country system has zero say in it because I am the empowered patient leading this because it's about my health or disease. So I want to get engaged and I want to be in control of this.
Yeah, I think you're right. I mean, I think consumers will ultimately kind of drive the opportunities, and I think it's going to be difficult for governments to try and prevent opportunities for people to receive better access to better healthcare. A few more questions, and then we'll wrap up. Look, you talked a lot about obviously the vaccine and the situation. It's quite clear that COVID is still very much on people's minds. So the question then is around if you have an autoimmune sickness, can the vaccine start a negative reaction in the immune system?
Sorry, just coming off mute. Thanks, Paddy. What we do know, again, there's been no studies, so it's emerging evidence in this area. But what we do know is that having a vaccine with a weakened immune system may cause the body not to have a full antibody response, right? So it may not create enough antibodies to give full protection against the virus. So I think what that means, and again, as time progresses, we'll get more evidence, but people who are clinically extremely vulnerable with a weakened immune system and autoimmune disease, they should have the vaccine if their healthcare professional agrees that's the right thing for them, but they should continue to follow all the advice on protecting themselves, reducing their risks of infection after they've had the vaccine.
Thanks, Luke. And no surprise, another question for you, Bertalan, and I think this will be our final question from the audience. But lots of people want to know what your prediction is a year from now, having not probably anyone been able to predict that what COVID would have appeared in our society a year ago. What do you think would be the biggest change in healthcare in 1 year from now?
Well, maybe three things. Two are based on technology. One is based on a principle. I think the two biggest trends will be about remote care, from video conferencing to any health sensor I can use and share the data remotely with my physician. These technologies becoming the new norm. The second is about at-home lab tests. I started talking about this in 2019, and the COVID pandemic just made it even bigger, that we don't want to get to the exposure, to being exposed to the infections, going to see other sick people by waiting for a lab test, while it's technologically possible to do a lot of types, not all, but a lot of types of lab tests, even blood-based tests. I've had many of them from home, even with US-based companies. I could make it happen in 1 or 2 days with shipping companies. So at-home lab test is going to be a big thing. The first COVID tests are becoming available in Central European pharmacies these days. So it's very much happening. And maybe the principle is going to be about, now we've seen what happens when healthcare is overwhelmed, when healthcare professionals struggle every single day, when it's not working properly. We all have to stay at home. Our lives are shattered. We cannot travel. We cannot work freely. So imagine the opposite of that. What happens when healthcare works perfectly well? When we can provide the right resources, train people as much as we can, and bring in the technologies that can make healthcare better. I think this is going to be the major message for every politician, every political party, every organization in the next couple of months or years, because now we've seen what happens when the opposite takes place.
Thank you. Thank you, Bertalan. Thank you for joining us this morning. Thank you also to Dr. Luke and to Claire. It's been a really great conversation. So we're nearly out of time for today's event. But before we close, I wanted to share some final reflections. Economic shocks like the coronavirus pandemic of 2020 only arrive once every few generations, and they bring about a permanent and far-reaching change. For the healthcare industry, we've experienced rapid change on a scale and at a pace never before experienced, and it will take a long time to fully understand the full implications. We're not just talking about giant leaps forward with technology, or that will be a big part of it. What we're really talking about is a significant social change, an understanding that the playing field must be levelled for all parts of society, and the crucial role that healthcare will play in helping us achieve that. The emergence of inclusive healthcare and its agenda will undoubtedly define the next generation. And as a global healthcare community, I think we all have a responsibility to take hold of this agenda and to help shape it. Thank you again for joining us and for listening. We hope you have found the event helpful and useful in your conversations with your customers, and we look forward to welcoming you back at our next event in April. Thank you and have a good rest of your day.